Hi, everyone. Welcome to today's session. Writing case notes shouldn't feel like a challenge, right? But for many professionals, it is. Whether you are a social worker, a case manager, a clinician, or a mental health provider, case note documentation is one of the most critical parts of your job. And yet, most professionals are doing it the hard way. Today, you will learn how to write effective, professional case notes using the most widely accepted formats. That includes SOAP, DAP, BIRP, and GIRP. There are other things you will get out of today's session. You will get very clear case notes examples. We will also provide you with two free downloadable case notes templates. And we will also provide you with tips to help you write faster, clearer, and most importantly, compliant notes without burning out. Here is what a lot of practitioners do wrong. They rush through case notes at the end of a busy day and they forget to document key client responses. They also have a habit of mixing up formats or adding unnecessary fillers. We've seen practitioners use outdated case notes templates. Others don't even know the difference between SOAP and DAP or when to use one or the other. We also see situations where some practitioners do not know how to link social work notes or other human services documentation to get client goals. The results? Weak case notes, audit risk, and lost time. Let me introduce you to Maggie. Now, Maggie is a seasoned case manager in a community clinic. Maggie puts in a lot of hours and she works hard, but her documentation was all over the place. During an audit, she was caught off guard with vague, incomplete social work notes. But after switching to DAP, the DAP format, and using a consistent structure, Maggie's documentation became a strength, not a liability, and her confidence increased. When you click on the link at the bottom of this video, you will be taken to the free comprehensive guide that really provides a lot of the content that we are going to be going over today. At the very top, we have the introduction section. And when you scroll down, you will see the story we just went over. And then keep on going, and you will be taken to the table of contents. Here at the table of contents, there are 6 key topics that we will be going over today. The first 6 that we are looking at here on my screen. The first one, why case notes really matter in social work and case management. Now, we understand not everybody watching this video considers themselves a social worker. That's fine. It's the same process whether you are a case manager, a nonprofit, a clinician, a therapist, a counselor, or a healthcare professional or specialist. When it comes to notes, case notes, it's really, this guide is designed to be a comprehensive guide to cover the different sectors. We will do a breakdown of SOAP notes and also highlight the correct structure you should apply. We will do the same thing for DAP notes, BIRP, GIRP notes also. We will also go over some additional real life examples. And then we will conclude by discussing how to download the free checklists. For now, let's jump right into discussing why case notes really matter in social work and also case management. And you don't have to read everything right now. Let me just summarize why case notes really matter. Case notes are not really just paperwork. They are really vital tools for tracking client progress, making informed decisions, and also ensuring accountability. Well written case notes support better collaboration between team members and agencies. They also serve as legal documentation and are often reviewed in audits, court cases, and multidisciplinary meetings. Writing clear and consistent notes helps protect both the client and you, the professional, as well as your organization. There are many reasons why case notes are important, including why it is really important that you follow the right structure. But for that, we will, just because we want to ensure that this video is not a 50-minute long video, let's move on to explaining SOAP notes next. So as you can see on my screen, SOAP stands for subjective, objective, assessment, and plan. Subjective captures what the client says. Objective is what you observe. The assessment interprets those findings, and the plan outlines the next steps. Subnotes are widely used in clinical, therapy, social work, and other clinical settings for their clarity and also compliance. And in regards to clarity and compliance, let us take a look at this example, this subnote example on my screen. Here is an objective. The client says, or the client said, I've been feeling anxious every morning. That's what the client stated, and that's what you should enter into the subjective section. Objective is your observation. So you notice that the client is fidgeting and appearing restless and they're not making eye contact with you. So you want to document what you are observing. Assessment: ongoing generalized anxiety affecting daily functioning. This is your interpretation of the situation. And then what is the plan? What are the next steps? Continue CBT. Explore coping strategies for morning routine. This is just an example, right? So even though we use CBT, we understand a lot of you might not be in the CBT sector, but these are just examples. Once again, this is applicable to every professional that is related to healthcare or note taking documentation. One thing to emphasize is this: you want to avoid entering too much information into each section. You want to keep it concise and focused on the situation. Another pro tip here that I would like to emphasize, just because we've seen a lot of practitioners make the mistake. When you enter the assessment, you are not really just stating the subjective and the objective. Instead, you are basically providing your clinical interpretation of the situation. If you are in a fast moving environment like community outreach, nonprofit, or case management, DAP notes might be your best friend. D stands for data. Here, you capture everything from what the client said to you to what you observed. A is your assessment, where you give your clinical take. And P is the plan moving forward. DAP notes save time and reduce redundancy. They are perfect for documenting targeted case management progress notes or writing social work case notes quickly but effectively. Now, down here, we provided information, detailed information in regards to step by step how to write the DAP note. So if you notice here in regards to data, we said capture the data, and we included the different steps to ensure that you check off to make sure you're doing this correctly. When we provide you with access to the checklist, you will notice that the checklist also includes these steps. The next one is how to write the assessment. Here we included the different steps for you to consider. We also included examples. For example, client behavior suggests social withdrawal and deepening symptoms of depression, lack of motivation, and isolation impacting daily functioning. That's an example. And then for step 3, outlining the plan, we also provided examples for what you can document when outlining the plan. And then down here is a sample DAP note, right? So data, assessment, and plan, we provided examples here for you. And then we also provide information in regards to why DAP notes are really effective. They are quick, they are fast, and they allow you to still be compliant without the level of detail that SOAP notes require. Now, some organizations, they require their staff to always go with SOAP notes versus DAP notes just because they like that level of documentation. Some organizations do. Most organizations, though, they are more flexible, allowing staff members to determine when to use a DAP note or when to use a SOAP note. Okay, now let us discuss BIRP notes. BIRP notes are all about clarity and accountability. They are especially useful in behavioral health and Medicaid funded programs. B means behavior, I, intervention, R, response, and P for plan. Behavior focuses on what the client did or said. Intervention outlines your actions and strategies used. Response captures the client's reaction. And plan details the next steps. You want to start with the behavior. What did the client say or do? Then your intervention, what did you do in response? Response, and then in the response, how did the client react? And then finally, the plan. Some people confuse intervention with response. No. Intervention is what you did in response to what the client said or did. Response is how did the client react. This particular note structure is excellent for, as I mentioned earlier, writing case notes in social work or documenting behavioral interventions. If you are working with vulnerable populations or billing through insurance, BIRP helps you stay covered. Now, here we've also included examples of a BIRP note. So let us take a look quickly at the example. For the behavior, we entered clients express frustration with lack of housing support. This is what the client did. They expressed frustration. Intervention is what we did. We reviewed available shelter options and we called intake line together with the client. The response. This is how the client reacted. The client appeared relieved and they asked additional questions. And what is the plan? Follow up in 48 hours to confirm placement status. What about GIRP? When is it used best? GIRP is a goal oriented note format that keeps your notes laser focused. You start by stating the goal you are trying to address or that you are addressing, something straight from the treatment or case plan. And then your intervention. What did you do to support that goal? Next is the response. How did the client engage or react? And finally, the plan. What is next? GIRP is perfect for writing documentation for social workers, case managers, clinicians, therapists, counselors, and other professionals who need to show measurable progress over time. Here's something else to keep in mind. It is also very helpful for supervisors and auditors who want to track goal alignment. Now, let us talk about case notes templates. Having examples and ready to use formats is a game changer, especially when you are managing a heavy caseload. Whether you are writing sample DAP notes, SOAP, progress notes, or social work case notes, templates help you stay on track. Using digital or printable case notes templates so you can document immediately after a session is the best practice. You want to ensure that you can customize them to meet your agency's needs, but keep the structure consistent. That is the key. Now, right here on this guide, we provide additional examples that you can follow along based on the type of case notes that you are documenting. You will notice here we provided additional information when writing a social work case notes template using a DAP format, or when writing a mental health SOAP note, or just a general case management BIRP note. We provided examples. Now, we also have people that operate in hospice. So if you're a social worker in hospice, or a case manager, or a therapist, or a counselor, or a clinician, and you want to write a GIRP note, you can actually follow this example that we have here. And then we also provided a little bit of information about you really don't need to reinvent the wheel when it comes to every note. Instead, choose the template that matches your setting and then just use that. We also mentioned the free checklists. There's actually two of them. And let me very quickly show you the two checklists. First checklist is rather more of an instructions and checks, more so than checklists. Let us go over this. So right here, it is broken into the different formats. For SOAP, there are instructions here. For example, does the note capture the client's own words, feelings, or perspective? Is the client's chief complaint or reason for the session clearly stated? So how different is this from this right here? This is the official checklist that basically tells you the key things that you should include when documenting the respective case notes. So here's the checklist, and then let me go back to the instructions and checks. So the instructions and checks really call out some key things for you to consider when doing your documentation. For the SOAP, there are things to consider under objective, under subjective, under assessment, under plan. It's a similar thing for DAP. We've included some things for you to consider. As an example, does this section combine both the subjective information, client's report, and objective observations? It's a call out. Now let's go to the checklist. The checklist says combine client's report and observations data. So it's more something you do and then you check it off. And as you can see here on the checklist, we have provided checklist items for the different types of case notes. And we've also provided general documentation reminders that are just included to help increase your success. And A key reason why is because we have seen practitioners make the mistakes. And so we want to call out something so you don't make that mistake. Here's one of them. We see practitioners make assumptions a lot. That leads to trouble. That leads to audit fails. That leads to potential legal issues for your agency, for your organization. As much as possible, stay objective and clear to protect yourself, your agency, your organization, and also the client. Let's go back to the instructions. Let me scroll all the way down. So down here, I want to just very quickly call out some few things in regards to GIRP. So if you notice here for GIRP intervention, we are saying, does the note detail the specific action or technique you use to help the client walk towards their goal? And I'm calling this out not just to be specific to GIRP, but to be specific to the differences between these two free resources we're providing to you. One of them, the instructions and checks, are basically things you should consider when doing your documentation to help increase your success in writing more effective case notes. Why the checklists are things that at the end of the day, you want to be able to say, yes, 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 or rather, check, 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 check. I did all of these things. Okay? We hope you have found this video on how to write the most effective case notes very helpful. Let us know if you have any questions, if you have any feedback. Most importantly, if there are additional topics you would like to learn about and you would like us to create a video or an article, don't hesitate. Let us know. We're here for you. And also take a look at other videos that we have published, all of them designed to help increase your success. Thank you.